All right. So as a recap from last time, the entire presentation is using health literacy to empower individuals and communities. And last time we talked mainly about, we started with community and the power of community-based approaches to health literacy. We recapped what some of the roots are of health inequities, mistrust in the healthcare system, and how important it is to forge effective relationships, and then how addressing both mistrust and health literacy together can help improve health outcomes, and the importance of community-based organizations partnering with healthcare organizations to be able to do that. Today, we're going to really delve more into, as an individual within the healthcare system, what are some skills and tactics that individuals can gain in helping to navigate the healthcare system and making their health journey more seamless, and really helping you all understand what those are so you can pass them on to the constituents who you work with. We're going to round off by talking about touching on a little bit about motivational interviewing as a tool to help behavior change as individuals try to seek to improve their self-care. Motivational interviewing is a course unto itself. So, even if I had the full 2 hours, we wouldn't really be able to really do it justice. So it's really just sort of a teaser to get you interested perhaps in learning more about it. Oh, my screen is not advancing. Let's try this again. Okay, there we go. So that's the session 1 that I just recapped and what we're going to talk about today. And so we're going to delve into individual health literacy, really how to prepare individuals for self-care and self-advocacy. And sort of already went over what we're going to be covering. Understanding the need for patient advocacy, especially for patients of color and individuals of color, using motivational interviewing to engage clients, and then empowerment and self-advocacy skills. I'd love it if everybody emerged with at least 3 skills that you yourself could take and pass on to others. So I'm going to start off actually asking for you all to participate with me, telling me a story. It says bad doctors, but really just any story that you feel like you could share within the healthcare system where things just didn't go well in terms of an encounter. We all have one. For myself, I about 15 years ago was in an accident, sprained my neck, thought it was minor, but over the next few days got increasing neck pain. When I lay down, it felt like I couldn't breathe. So I went to the emergency department at 2:00 in the morning, one nearest to my house, and I'm an emergency medicine physician, as a reminder. The physician there, gave me some pain medicine, did a CAT scan of my neck. I told him, I probably really need an MRI, but the MRI tech isn't in the hospital in the middle of the night. So he did a CAT scan. Results came back, everything looked good. And so he assumed that because I said when I laid down, I felt like I couldn't breathe, he assumed that I was being, quote unquote, hysterical, or that I had anxiety. And so he gave me a anti-anxiety medicine and sent me home. And a few hours later, I got a call. A nurse in the emergency department had recognized me, told the senior physician who came on in the morning, the chair of the emergency department, about the whole thing. He called me and said, "Hey, do you want to come back at an MRI?" I said, yes. I came back. The MRI showed that I had torn a muscle and it was bleeding, like a collection of blood was pushing on my windpipe. And so I had to have emergency surgery. And, you know, it just struck me that, was it because I was a woman that he assumed there was anxiety? Because I was a person of color, he wasn't taking me seriously. Lots of literature, around that, with that initial doctor. And it was only because of my quote unquote status as an emergency physician that I actually got the care that I needed. So if anybody would like to share their story, that's mine. But feel free to jump in. Anybody there?
Yep.
Okay. Well, if nobody wants to share, that's fine. I really wanted to just talk about the importance of patient advocacy and the things that we're going to cover today, because not all healthcare system encounters are going to go in an unbiased, um, totally equitable way. And so that's why health advocacy is important, and understanding how to navigate the healthcare system is important. And the first sort of topic I want to cover is why it's important to not be a patient, quote unquote, patient. We're going to talk about 5 strategies for self advocacy. So, being prepared for healthcare visits, knowing what to ask for, getting the free stuff, not going it alone, and knowing who's on your team. And then finally, we're going to wrap up with the motivational interviewing around helping to establish health goals and behavior change to support those goals. It's important to know, for yourself and for the constituents who you represent, what does good look like? What are the rights of individuals when they enter into the healthcare system? And I kind of like to take all those rights and roll them up into 4 broad categories. The right to expect high quality quick care, no matter who you are. It should be safe, done in an effective, clean environment, a secure environment, and get care that's sensitive to your cultural background and beliefs, with interpretation services at no extra cost. It's important to get clear communication. So, to be informed about your condition in language you can understand, as well as the proposed treatment and alternatives, the risks and benefits. To know that you have access to your medical records. And as recently as last year, a new law was passed that said you should be able to actually see your medical record and ask for corrections to be made if you feel that your story was captured inaccurately. And then from a financial standpoint, get a clear explanation of charges, ways that that you can pay, and what financial assistance might be available. The next broad category, autonomy. So that's basically involving you in decision making, called shared decision making, and the right to file a complaint or refuse treatment. And then finally, safeguards around your privacy and your confidentiality. So that's what good looks like. And so again, we know that good doesn't always happen. So I like to include these pictures because it sort of sets it up to talk about why it's important to not be a patient. So does anybody want to sort of throw out some words that sort of come to mind when you see these 2 pictures? Yep, disconnected, isolated, uncertain. Anything else? What about that picture in the bottom right? It's almost like she's being ignored, basically. So in addition to the disconnection and uncertainty, everyone else is sort of going about their business, and she's there alone, seemingly ignored. And it's important to know that the word patient comes from the root word in Latin, which means to suffer. And while it does feel like you're suffering, obviously when you're sick, the word suffering also puts you into a passive mindset. And when you're a passive mindset, you might feel like you don't have a lot of agency and a lot of control about what's happening to you. But in terms of the ultimate outcome for your health, you actually have the most control. We've talked before about, 20% of your health outcome has to do with what happens in the doctor's office or in the hospital. 80% actually happens in terms of you're executing whatever the plan of care is that that jointly, hopefully, you've come up with your healthcare provider. And if you don't feel empowered within that interaction, you're less likely to understand your own agency in how you can affect your current health condition. And I like this picture of the dinosaurs. It reminds me, the last time the dinosaurs got together, they voted not to change. And so if you don't realize that you have the agency to change and you're empowered within that interaction, and to change that interaction, then things are always going to sort of go along the same path potentially. And the other consequence of being a patient is it leaves you more vulnerable to the unintentional mistakes that can occur in the course of your care, such as happened to me. And it's even more important for women and people of color to advocate for themselves because of what we covered in the first section, which is women are 20% more likely to have a medical mistake happen to them than men, controlling for, the fact that women access the healthcare system more than men. And the same, people of color, 30% more likely to have a medical mistake. And again, well documented in the medical literature. So it's even more important for women and people of color to understand the principles that I'm going to talk about in terms of self-advocacy. Bottom line is, people who are their own advocates are more satisfied with the care they get. But in order to self-advocate, again, you really have to go into the encounter with the mindset of, I deserve the best. And if I feel like I'm not getting the best, I feel empowered to advocate for myself. And a lot of times, as women, as people of color, the messages that we get are disempowering in society in general and from the healthcare system. So intentionally has to be fostered to think of yourselves in that role as a self-advocate, or if you're advocating for someone else, again, to assume my attitude is, this person I'm advocating for, or I deserve the best. So then that sets up what are the 5 healthcare strategies for self-advocacy that we'll touch on today. Well, the first one is being prepared. Always, any situation, the best, being prepared for the healthcare encounter you're going to have. Obviously, if it's an emergency situation, you can't do that, but an ordinary primary care encounter or referral to a specialist. Not being a patient means, bringing a list of your actual medications. And if you don't have a list, just pile up the bottles, put them in a bag, and take them to the visit. Be ready to explain your story. And basically that falls down into 3 components. What's bothering you? How long has it been bothering you? And what have you already tried, including going to other doctors, other remedies, etc. A lot of sometimes people want to hold that back for various reasons, but it's important to sort of put everything on the table, because that helps the healthcare provider understand, okay, well, it helps to actually direct them to come up with a diagnosis. And then this is less important now that we have access to patient portals, but if you know your past and present diagnoses, that's very helpful. And if not, give your healthcare provider access to your medical records so they can figure it out themselves. So, being prepared, strategy number 1. Strategy number 2, know what to ask for. And there are a few components to this. expecting more from your doctor, asking the right questions, and always getting copies. I'm going to cover each one of those. So it's important to, when you're meeting a doctor for the first time, understanding in your head, what is it that I want? What is an ideal encounter? What makes me feel most comfortable in an encounter with a doctor? And look for that in that particular encounter. Expect it and conduct yourself accordingly to those expectations. And then it's also important to look for the highest quality doctor, not just the prettiest face. That's why I have these pictures up here to remind me. You want to get the highest quality primary care doctor that you can find. So how do you go about doing that? Well, it's important to seek out practices that are patient-centered medical homes. What does that mean? That's a healthcare practice that has been designated by a governing body called NCQA as setting up the processes and the framework to make sure that the care they're providing puts the patient in the center. You would think that that would be automatic, right? But just an example. Most doctors' offices are open from 9 to 5. Well, most people work from 9 to 5. So that means you have to take off time from work to go to a doctor's appointment. Patient-centered medical practices often have evening hours and weekend hours with that in mind, so that they can accommodate people with schedules of who work in the day, which is the majority of people. So that's an example of a patient-centered approach to care. The care is often team-based. So it's not just the doctor involved. There's often maybe a case manager or a social worker. Maybe there is a nutritionist or a podiatrist who's part of the team who is available at that in that practice to be able to more holistically meet the needs of the patients at the practice. Oftentimes, they're private practices that have this designation. Oftentimes, federally qualified health centers, also known as community health centers or free clinics, different names, but those that are federally qualified health centers are ones that get additional funds from the federal government to be able to implement these kinds of programs and this approach to care. So how do you find them? You can go to the website of the National Commission on Quality Assurance, NCQA, the ones that certify practices, clinical practices with this designation. Enter your zip code and get a list of those patient-centered medical homes in your area. They also rank health plans. So for example, if you're trying to find a best practice health plan in a city, you can go to this website, see how the different health plans are ranked. And also healthcare organizations like hospitals also get ranked as well. Just trying to advance the slides. And there we go. All right. So the next piece I wanted to cover under know what to ask for is interviewing your doctor to check out their skill set and whether it meets with what you need. So do they listen to what you have to say? Are they focused on you? And if they get distracted, do they apologize when they come back to you? Do they seem to listen to you with compassion and understanding for what you're telling them? If it's important to you that, you're able to share with them that you went to the chiropractor or that you had acupuncture, do they have an openness to that? Do they use simple language when they communicate? Very important. And if you tell them, hey, I don't understand, can you re-explain? Do they do that patiently? Shared decision-making, what I what I mentioned before, if there's always more than one way to skin a cat, right? There's more than one approach to a problem. And so if that doctor, sort of says, this is the only way to do it, my way or the highway, that person isn't really outlining the various options, which always include not taking the treatment, or the procedure that's offered, but they need to be able to explain to you what are the risks of taking this particular course of action, so that you can sort of decide alongside them what works for you. And then if you ask them a question that they don't know, do they seem to make up an answer, or do they say, hey, I don't know, I'll get back to you? All these are qualities that you should or could look for in a doctor if they're important to you. And then again, under knowing what to ask for, asking the right questions. And I would say this is probably the most important slide that I'll cover today, because this really helps to make sure that you get what you need out of that healthcare encounter. This is a picture of my book. This is in chapter 7, relating to your doctor. Took it straight out of there. Number 1, what's wrong with me? And if you can't tell me, which oftentimes happens by the end of the encounter, tell me the top 3 things that you think could be wrong with me and what you're going to do to rule it in or rule it out. The second is, what do I need to know about the treatment that you're about to give me? So how soon is it going to kick in? So that's the effects. The side effects. So what should I be watching out for to tell me, okay, I need to stop this medicine? And the cost. How much is it going to cost? Because if I can't afford it, I'm not going to take it. So treatment. Number 3, what are the alternatives to the prescribed treatment? And we just talked about this. There are always alternatives, even if not taking it is always an alternative, but there might be consequences, and you need to understand what those are. What are the next steps? Well, that simply means, when do you want to see me back? Are you referring me to somebody? Do I need to call and make that appointment, or is your front desk going to do that for me? What are the next steps in my treatment? And then finally, what do I need to do at home? And again, remember I said 80% of your health outcomes have to do with your executing the care plan that you've come up with. So this, what do I need to do at home piece, is really key. Do I need to be checking my blood sugar or my blood pressure at home? Do I need to be walking every day for exercise? Do I need to eliminate salt in my diet? What do I need? What do you want me to do at home until I see you next? So those are the 5 must-know questions you should never leave the doctor's office without getting answered. All right, so that's the must-know questions. And finally, under what to ask for, always get a written copy of your test results. Now, written could also mean digital, but you should have them digitally. If they're digitally available, the doctor should show them to you on the computer screen or on your device before you leave their office, so that you can ask them, what does this mean? And you can get a clear understanding of what it means, especially if there's abnormalities in the lab values. So again, get the results, know what the labs or any tests, imaging studies, get a copy of those, and ask the doctor to go over them with you. So that's all under knowing what to ask. Strategy 3, get the free stuff. You don't want to pass the free stuff up. What's free? Well, that generally means if you have insurance, any kind of insurance, that their health insurance, that there's no copay for these services. So those include yearly checkups. Now, the moment that you say, oh, but I have a headache, or, oh, my foot hurts, it's no longer a yearly checkup. It then becomes a problem-oriented visit. So This is purely for yearly checkups. You're going in for your physical, and that's it. Any screenings or counseling for all these things: colon cancer, diabetes, high cholesterol and high blood pressure, obesity, domestic violence, depression screenings, sexual health screenings, all that's free. Counseling for alcohol and tobacco misuse, free. Checking to see if you're pregnant, free. Breastfeeding support and supplies, free. Routine vaccinations, and for kids, vision and health screenings and developmental assessments. All those things, no copay. And again, the free stuff is free if you have insurance. And these are the different types of insurances: Medicare or Medicare Advantage for people over 65 or those who have long-term disability, such as with kidney disease. Kidney disease that requires dialysis. Medicaid, there's an income requirement for that. Marketplace plans, so that's the Affordable Care Act healthcare marketplaces, being able to buy insurance on those. And the cost of the insurance is income based. And then employer based, obviously getting it from your job. If you're uninsured, and you don't qualify for Medicaid and you haven't purchased a plan on the healthcare marketplace, you can go to federally qualified health centers and receive care on a sliding scale. So again, you'd only have to pay what you could afford. And then these are also free additional resources that people can take advantage of. The Patient Advocacy Foundation, and there's the URL there, www.patientadvocate.org. If you're having problems paying medical bills, especially copays, if you live in a county designated by the CDC as socially vulnerable, they can provide help in helping to pay your medical bills. And they provide free case management if you've been diagnosed with a chronic disease and need access to care, or help paying for your medication, your living expenses, or help with insurance or disability claims. And if you're a veteran, the Veterans Administration has a patient advocacy program similar to the Patient Advocacy Foundation, but it's just for veterans. So that's get the free stuff. And then number 4, don't go it alone. So what are the reasons to not go to a doctor's visit alone? A, to help make sense of and remember what the doctor says. B, to ask somebody to ask clarifying questions. C, to provide support in telling or remembering the whole story. D, all of the above. Hopefully everybody got to all of
D, all the above.
There you go. There you go, Ed. Absolutely. I often say that, the squeaky wheel gets the most oil. So someone else who can help squeak is invaluable. And that might not necessarily be your spouse or your significant other. It might be somebody, whoever your friend is, or somebody who you know, who's detail oriented, a good listener, and a good advocate. Those people are super important, whether it's a doctor's visit or whether it's a hospital stay. If it's a doctor's visit and somebody can't go with you, ask if you can record the visit so that you could play it back for, whoever helps you with your healthcare if you need that. And then strategy number 5, know the members on your healthcare team. You're the coach, right, when it comes to your healthcare. And so you got to know your players. So who's your primary care person, physician or nurse practitioner? Who is your specialist if you have them, and what do they do for you? Are they a lung specialist, a urinary system specialist, a heart doctor? And again, you might have a nurse case manager, a social worker, a health navigator, who's someone who is trained specifically to help you navigate the healthcare system. They're not a healthcare provider, but they might have a lived experience of what you've gone through, whether it's a mental health challenge, whether it's cancer, whether it's diabetes. They're ones who are specific to specific issues, and they often can be assigned to you, especially if you're getting care at a hospital. Um, you might have members on a rehab team, so occupational therapy, physical therapy, speech therapy, a nutritionist, who's your pharmacist or the pharmacy that you go to. So all these are potential people on your team that ideally you know and know how to get in touch with. So I'm going to stop there before we go into the last part of the talk and see if there are any questions, any thoughts that you want to share with others. All right. Well, if not, as I said, I'm just going to give you an appetizer when it comes to motivational interviewing. So, what is motivational interviewing? It is a framework for engaging with individuals and honoring their own wisdom when it comes to supporting behavioral change, right? So it helps people explore and resolve their ambivalence to change. The idea isn't to impose your will or your thought about how something should happen on them, because that might be inconsistent with their own values or beliefs or wishes, and actually cause them to create a barrier, really, to them changing. It really supports change that's in congruence with the person's own values and belief systems and wishes. And there are some guiding principles around motivational interviewing. One is, very first one, as I mentioned, resist telling the person what to do. Again, as oftentimes, if you're in a person supporting role at your job, whether it's in healthcare or social work or closing social needs gaps, we often have that personality of, yeah, I see a problem, I want to fix it, right? But it's being able to step back and squash the need to do that, and allow the person that you're working with to sort of come up with the solution on their own. And in doing so, you have to understand that person's motivation. What's important to them? So, for example, it might be important to them to be able to look great at their high school reunion, or be there when their child graduates from high school in 2 years. Tap into the things that are important to them, to help be a goalpost for what they're trying to achieve, and understand what are their potential barriers that they see to getting to that goal or that value that's really important to them. It necessitates listening with empathy, to be able to understand. And then lastly, the last step is to empower. So to empower them, there are specific techniques within motivational interviewing that helps you be able to work with the individual to take what they've told you and turn it into a goal, and also help to navigate them through the process of identifying the barriers and coming up with specific plans for how they'll work through and overcome those barriers. Some strategies that motivational interviewing includes are ORS is the mnemonic. The other one was rule. ORS is asking open-ended questions. That's really key for giving people the space to talk and express themselves. Being affirming of listening affirmatively, so the repeating back what they've said so that so that they feel heard, and that helps to build trust. Um, that's also part of reflective listening, and also helping to summarize. And actually, let me not skip over reflections. Reflections are very key. Reflecting back to people what they tell you is a specific technique, again, for helping identify what the barriers are, what the challenges are, and what the goals are. And then at the end, providing a summary to your encounter so that you're both on the same page about what they've identified as their path forward is. And then this finally summarizes, this is sort of a checklist that you can use yourself to ensure that you are using the motivational interviewing techniques maximally, and that you're executing them in a way that is going to be productive for your discussions. So, am I listening and supporting? Am I listening more than I talk? Am I encouraging the person to talk about their reasons for not changing, as well as their reasons for changing? If I give feedback, am I asking permission? So again, a whole checklist that you can go through with whoever you're assisting to make sure that you're engaging in motivational interviewing in a way that's productive for that particular client. And so I'm going to wrap up there. I thought it would be good to leave time for any additional questions. Perhaps there are people who are already using motivational interviewing in the work that they do. I thought it was important to talk about it in the context of advocacy, because you can help people become more empowered around advocating for themselves by using motivational interviewing to help them understand the importance of advocacy, and what it would take to help them be better advocates in their own healthcare, as well as um, the need for if there's needs for behavioral change to get to the goals that they want for their own health. So again, I'll stop here and happy to take any questions or listen to what you all have to say based on your experiences around um, community advocacy, individual advocacy, stories that you might have from your own life or your family's life that you might want to share with the group that might help illustrate some of the things we've talked about today. Open discussion time.